The National Institutes of Health reports insomnia as a common sleep disorder affecting up to half of patients with schizophrenia. Insomnia can also increase the risk of suicide in schizophrenic patients. Doctors at the Medical College of Georgia at Augusta University are investigating ways to lower this risk and improve patients' quality of life. Tiffany Hobbs has the story.
Insomnia disorder affects about 10% of adults.
Insomnia was a risk factor for suicidal thinking, suicidal behavior, and suicide death.
During his earlier studies, Dr. Vaughn McCall says he wanted to see if treating insomnia in people with active suicidal thinking would make a difference.
It did. If treating insomnia appeared to mitigate people's tendency towards suicidal thinking. This was the first time that had been shown.
Now he and Dr. Brian Miller are working to treat this occurrence in patients with schizophrenia using a drug called clozapine.
We use it because it dramatically changes people's lives when it works. I've started patients on clozapine who are able to go back to school and finish degrees.
Dr. Vaughn notes that a person's ability to think clearly is noticeably diminished if they don't get enough sleep.
The decision they land upon is I might commit suicide, which is a decision they may not make if they slept better.
The doctors are also looking at ways to better recognize signs and symptoms of high alertness, which is often linked to insomnia. Using a device called a pupillometer, they can measure the rate of pupil responses to determine the patient's level of physiological excitement. It has proven to be a helpful instrument in the stages of both diagnosis and treatment.
We have an additional study with the pupilometer to measure these pupillary responses to light in patients before and after they get treated with clozapine.
We think that the autonomic nervous system will tell us things about the patient that they may not be able to even access themselves.
Doctors Miller and McCall tell us they remain committed to proving their hypotheses and providing better care for patients in need. In Augusta, Tiffany Hobbs, WJBF, News Channel 6.